You have less than 20 minutes to breathe, or your lungs shut down. And the worst part is, you might not even feel it happening at first. The black mamba is not just another venomous snake with a dramatic name. It is one of the fastest-acting neurotoxic predators on Earth. Untreated, its bite can end a human life in as little as 20 to 30 minutes, not because it tears you apart, not because it causes catastrophic bleeding, but because it quietly shuts down the system that keeps you alive. And when your breathing muscles stop working, there is no willpower strong enough to override that. The black mamba lives across large regions of sub-Saharan Africa. It is long, slender, and capable of reaching over 14 feet in length. Despite the name, its body is not black. The name comes from the inky darkness inside its mouth, which it displays when threatened. It is fast, alert, and extremely defensive when cornered. When it strikes, it does so with explosive precision. The movement is so fast that the human eye often cannot fully register it. Unlike many vipers that strike once and retreat, a black mamba may bite repeatedly in rapid succession. 2, 3, sometimes more strikes in less than a second. Its fangs are fixed at the front of the mouth, shorter than the long folding fangs of vipers, but perfectly positioned for efficient venom injection. These fangs are hollow, like hypodermic needles. As the snake bites, muscles around its venom glands contract, pushing venom down through the fangs and directly into muscle tissue. Each bite can inject anywhere from 100 to 400 milligrams of venom. The venom enters muscle and begins spreading almost immediately. It travels through lymphatic vessels first, then gradually into the bloodstream. Unlike hemotoxic snakes, which attack blood cells and destroy tissue, the black mamba's venom is primarily neurotoxic. It does not need to cause visible destruction. It attacks communication. Your body runs on electrical and chemical signals. Every movement you make, every blink, every breath, depends on nerve cells releasing a chemical messenger called acetylcholine. This messenger crosses tiny gaps between nerves and muscles, binding to receptors and telling muscles to contract. Black mamba venom interferes with that system. Within seconds of envenomation, toxins begin targeting neuromuscular junctions, the precise points where nerves talk to muscles. Several components are responsible. Alpha-neurotoxins bind to acetylcholine receptors, preventing the signal from attaching. Dendrotoxins interfere with potassium channels in nerve cells, disrupting the normal firing pattern of nerves. At first, this can cause subtle abnormalities. You may feel tingling around the lips. A metallic taste might appear in your mouth. Some victims describe mild dizziness or blurred vision. There may be local pain at the bite site, but often far less than expected from something so deadly. That is what makes it deceptive. In the first minute or two, you might think you can manage it. There may be sweating, anxiety, a racing heart, but externally, nothing dramatic is happening. There is no massive swelling, no tissue blackening. The skin may show small puncture marks and little else. Meanwhile, internally, the shutdown has begun. As the venom spreads over the next few minutes, cranial nerves become affected. These nerves control facial movement, eye motion, swallowing, and speech. The eyelids may begin to droop. This condition is called ptosis. It can happen rapidly. You may struggle to keep your eyes open. Vision may double because the muscles controlling eye alignment weaken. Speech begins to slur. Words feel heavy. The tongue may not respond properly. Swallowing becomes difficult. Saliva pools in the mouth because the muscles coordinating swallowing are losing control. Muscle weakness then spreads downward. The arms feel heavy. The legs may tremble. You may try to stand and feel unstable. Your coordination begins to fail. This is not because you are fainting. It is because your muscles are no longer receiving clear instructions. Inside your nerve cells, dendrotoxins are disrupting the balance of ions required for proper electrical signaling. Potassium channels help reset nerve cells after each signal. When these channels are blocked, nerve firing becomes erratic at first, causing twitching or small spasms. But this instability eventually leads to exhaustion and signal failure. And this is where it becomes terrifying. The diaphragm, the large dome-shaped muscle beneath your lungs, is entirely dependent on nerve signals from the brainstem. Every breath you take requires a coordinated electrical message traveling down the spinal cord through peripheral nerves and into the diaphragm. When acetylcholine receptors are blocked, that message cannot complete its journey. At first, Breathing feels shallow. You may notice you cannot take a satisfying deep breath. You inhale, but it feels incomplete. Anxiety increases. Your body senses rising carbon dioxide levels in the blood. You feel air hunger, the desperate urge to breathe more deeply. But your diaphragm is weakening. As paralysis progresses, intercostal muscles, the muscles between your ribs that assist breathing, also fail. Each breath becomes smaller and more inefficient. Oxygen levels begin to drop. Carbon dioxide rises further, causing headache, confusion, and eventually loss of consciousness if untreated. In severe cases, complete respiratory paralysis can occur within 20 minutes. You may be fully conscious while unable to move your limbs. You may hear people speaking around you but cannot respond. Your chest may barely rise. Without mechanical ventilation or assisted breathing, oxygen deprivation leads to brain injury within minutes. Cardiac arrest typically follows not because the venom directly attacks the heart muscle, but because prolonged oxygen deprivation causes the heart to fail. Historically, before antivenom was available, mortality rates for untreated black mamba bites were extremely high, often approaching total fatality. Accounts from earlier decades describe victims collapsing rapidly, sometimes within half an hour. Today, the outcome depends almost entirely on speed and access to medical care. If antivenom is administered early, it binds to venom components circulating in the bloodstream and neutralizes them. This prevents further toxins from attaching to nerve receptors. However, antivenom cannot instantly reverse toxins already bound to receptors. Recovery takes time. Many patients require intubation and mechanical ventilation. A machine breathes for them while their nervous system gradually clears the toxins and regenerates functional receptors. This can take hours or even days. With rapid hospital treatment, survival rates are now high, but the margin for error is narrow. In rural areas where transport to advanced medical facilities can take hours, survival becomes far less certain. Without ventilation support, respiratory paralysis is frequently fatal. There are also secondary complications. Severe envenomation may cause excessive sweating, salivation, abdominal pain, nausea, and vomiting. Stress hormones surge. Blood pressure may initially rise due to sympathetic activation. Later, as hypoxia worsens, blood pressure can drop. Psychologically, the experience can be traumatic even for survivors. Being conscious while losing voluntary control of your body is profoundly distressing. Some survivors report long-term anxiety related to breathing sensations or panic episodes triggered by minor respiratory discomfort. Despite its lethal capability, the black mamba is not a predator of humans. It does not seek confrontation. Most bites occur when a person accidentally steps near it,